I want to bring in NBC's Gabe Gutierrez, who covers the White House. Dr. Kavita Patel served as policy director in the Obama administration and is an MSNBC medical contributor. Sam Stein is an MSNBC contributor and managing editor at The Bulwark. With me here in studio, MSNBC legal correspondent Lisa Rubin. So, Gabe, this could be the shortest serving CDC director of all time. Trump picked her himself just a couple of months ago. At that time, he called her an incredible mother and dedicated public servant. How did things go so far south so fast?
Well, hi there. Good afternoon, Chris. Well, certainly the White House is saying that her positions on many things did not align with its agenda, even though the CDC, of course, has been largely a non-political entity before. Now, Dr. Richard Besser, former CDC director, told reporters today that he had spoken with her and that she had refused to fire some top agency leaders and also refused to sign off on some of these vaccine changes that Robert F. Kennedy Jr. Had wanted. Again, that's according to Dr. Richard Besser. But the White House was out with a statement overnight responding to her not wanting to resign at this point. The White House saying that, as her attorney's statement makes abundantly clear, Susan Menarez is not aligned with the president's agenda of making America healthy again. Since Susan Menarez refused to resign despite informing HHS leadership of her intent to do so, the White House has terminated her from her position with the CDC. Now, Chris, this comes as the administration really has little patience or tolerance for agency leaders that don't seem to be aligned with the president's agenda. Again, even though the CDC has long been a non-political agency, Chris.
Gabe, thank you for that. Doctor, I can't overstate the experience, the depth of knowledge of the four other people who say that they cannot anymore, in good conscience, work at the CDC. I want to read part of Dr. Descalz's letter. I should say that this is the top respiratory illness and immunization official at CDC. Quote, having worked in local and national public health for years, I have never experienced such radical non-transparency, nor have I seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. So he's saying this isn't just about supporting controversial positions. He's alleging they're fudging data to support the changes that they want to make. If Americans can't trust what the CDC is saying, what's the impact of that?
Hi, Chris. Good to be with you. The impact is incredible. I've been trying to wrap my brain around the impact because it's global. It's not just a United States institution, but many global public health agencies look to the CDC for their guidance. So the impact is absolutely going to reverberate. And I hesitate to say that the damage is already done. I want to try to be positive and say maybe we can get a leader, but I have no reason to believe that in this administration such a leader would be supported. And you read from Dimitri's letter, I've worked with many of these people. They do not suffer from malaise. These are not people who pride themselves in being political about anything. In fact, the alignment with the administration should come from sitting at a table, reviewing the data, having a conversation, and thinking about what we need to do to protect the American public. And from that letter you read, he talks about how he had been waiting to do that, and not once had him or anyone on his team been asked for a briefing or to be included in any discussions. That should tell you a lot.
So, Lisa, let's go back to Menarez for a second. Her lawyers say she hasn't been fired. So what's going on?
Well, the White House has said she has been fired, but apparently the letter that she received was from a staffer at the White House. And her lawyer's position is, as somebody who was nominated by a president, confirmed by the Senate, the only person who can fire her is President Trump himself. That a letter from a personnel official at the White House doesn't suffice to terminate her in this instance.
So they believe legally he can't separate himself from this. He can't say, this is a decision I left to the people who oversee the CDC.
Yeah, essentially, they're saying he cannot delegate this decision. As somebody who has been nominated and confirmed by the Senate, This is a decision from a personnel perspective that has to be executed only by one person, the President of the United States.
Could this lead to even a broader legal fight? I mean, like the one that seems to be unfolding over what's happening at the Fed with Lisa Cook.
Well, the situation at the Fed is a little bit different because there, a Fed director can only be terminated for cause. Fed member terms are supposed to extend beyond the life of any one president's term. It's supposed to have some balance by party. The Fed is much more akin to a number of other multi-member agencies. And in certain circumstances, courts have upheld the president's right to fire those other people. But here, the CDC director is differently situated than a member of the Fed. If the president wants to fire the CDC director, similar to any other cabinet official, the president can pick up the phone and terminate that person. It's well within his powers to do so. All that her lawyers are saying right now is that President Trump hasn't exercised those powers.
Sam, you've written, you've posted a lot about this. You said that this could be one of the most critical periods we've ever seen in terms of the literal health of America. What do you see as the stakes?
Well, just that. What we witnessed last night was the purging of decades of institutional knowledge from our most important preventative disease agency in the country. And this comes on the heels of a few things. One is Robert F. Kennedy Jr. has taken concrete steps to erode trust in vaccines. The advisory panel on vaccines, he is stocked with people who are skeptical of vaccines. Just this week, he has limited the ability for people to get COVID booster shots unless you're young or elderly. And we are anticipating in the month ahead that he's going to produce a report that will push long discredited ties between autism and vaccinations. So as you see people leave the CDC, you have to consider the context. Now, I was talking to folks who are in touch with those CDC officials or have been in touch with those CDC officials. I just think it's important to understand they didn't want necessarily to serve in this administration. They have differences with Kennedy, obviously. But what had kept them in their positions was that they felt obligated to try to mitigate some of the harm. And they had told these people that they would only leave if they felt they were being forced to do things that would actively harm the American population. And so the fact that they are leaving now suggests that they've determined that the steps they're being asked to take will create active harm to the American population. I don't think anyone I've talked to in the medical or health communities has ever seen anything quite like what we saw last night, the purging of these people from these critical positions.
So I want to go to an even bigger picture than what Sam just said, Doctor, and what you touched on, because if you follow this closely, you've seen that already in the medical profession across America, changes have happened as a result of the things that this administration has done and said. I'm talking about changes, for example, like access to abortion, access to vaccine, access to care for trans individuals. So it comes at what's already a fraught time for the CDC, the shooting at agency headquarters right in Atlanta, budget cuts, mass layoffs. Where does that leave the average American who's looking for guidance on everyday health care, on staying healthy?
It leaves them incredibly uninformed. And unfortunately, because of access issues, the inability to have these conversations. We're going to have to do it block and tackle one-on-one. That's basically what we're doing. And we're having to not go to cdc.gov for our guidance. We're going generally to our societies, the American Academy of Pediatrics, American Academy of Family Medicine. We're going to the societies to try to find and vet at least the science as it is. So the average American, I really do think they should be worried. We've seen not just the NIH grants could bring forward cancer cures get cut and taken away because it included language around DEI. But we've cut off any mRNA vaccine technology, which, by the way, helped save our lives during COVID. So this is, I just, Sam is right. I mean, literally, this was something that happened overnight. This is something that I knew would happen in this administration. Didn't think it would happen in month 8 of an administration.
So, Sam, it was less than a month ago, right, when 51 Republicans voted yes on Menares' nomination. Where are they today?
That's a great question. We've seen one Bill Cassidy, who runs or chairs, I should say, the Help Committee in the Senate, who was very critical, mind you, for Robert F. Kennedy Jr.'s nomination. He said, well, these dismissals require us as a committee to have some oversight. Fairly limp response, honestly, but it is a response. Democrats, meanwhile, have been apoplectic over this. Patty Murray has called for RFK Jr.'s firing. Bernie Sanders has called for hearings into the matter. We will see. They come back in a couple days from a August recess. And look, I have to think that a number of these Republicans don't like what they are seeing. I understand that the MAHA movement has taken over much of the Republican Party, but the MAHA movement is around diet, health, exercise, self-betterment, taking care of your body, things like that. It doesn't necessarily overlap with getting rid of long-standing access to vaccinations that we as a society have become accustomed to. And I have to imagine that there's a number of people out there, voters, including in the Republican Party, who are deeply uneased by the idea that, you know what, maybe they can't get access to their COVID booster, or maybe, in fact, they will be, have trouble getting access to regular vaccinations. And so we'll see what the reaction is when members get back in. But so far, much of the reaction has been on the Democratic side, with only a scattering of reaction on the Republican side.